Hello, this is Dr. Kangong, just coming to you today to talk about prediabetes. It's the end of the day, and I've seen so many people today with prediabetes, so I just decided to talk a little bit about it. So, what is prediabetes? It's just a warning sign that you're at risk for getting type 2 diabetes, which means that your blood sugar is higher than it should be, but it's not high enough to be diabetes. The food that you eat naturally turns into sugar. Your body will use the sugar for energy. Normally in the body we have an organ that's called the pancreas that makes insulin. And the insulin would allow the sugar in your body to get into your body cells. But sometimes the body just can't use insulin the right way. So the sugar stays in your blood instead. This is called insulin resistance. The buildup of sugar in your blood means you have prediabetes. What the good news is, you may be able to prevent or delay it. Making small lifestyle changes like getting active and changing your eating habits may help you to get your blood sugar back to normal. So what do I mean by making changes in your eating habits? So a lot of times we have a lot of carbohydrates and also refined foods in our diet. So an example might be things like pop, things like soda. Sometimes we consume a lot of that and it's very, very high in sugar. I would advise you to always, once you pick up a bottle of soda, look at the amount of sugar in it and you'll be very surprised how much sugar is in it. Also, even the things that you have in the store that says made from natural fruit sources, fruit concentrate, if you look at the amount of sugar in it, you'll be surprised that there's that much amount of sugar in it. So I think I would prefer you have more, eat the fruits instead of having those processed like the drinks. They call them made from concentrate or pure, 100% pure, but most of the time it's not really 100% pure. And so going back, talking more about the eating, what can you do? A lot of times when we eat our plate, it has more carbohydrates than the vegetables, than the protein. I always would recommend you increasing your protein source and also cutting down on the carbohydrate. Like for us typical Africans, what happens is, and it's same in other cultures, like Asians, from what I hear from my patients, they have a big bowl of rice and then a little piece of sauce, a little bit of piece of fish or meat. I would recommend at least 3/4 of the plate, or if half of the plate will be more veggies, then you have your protein and then you can have your carbohydrates. So if it's brown rice, I would recommend you change it to if it's white rice, I recommend you change it to brown rice. You can also use things like quinoa, which have a low glycemic index, meaning it's not going to spike your sugar. And so it's easy to detect your blood sugar or pre-diabetes in the lab. A simple blood test can help you. In Canada, pre-diabetes is about 5.7 to 6.4. That's the percent level. But then in different parts of the world, usually it goes by milligram per, some places it's milligram per deciliter, which is the fasting plasma glucose. So about 100 to 125, that will be the level for pre-diabetes. And if you're doing the oral glucose tolerance test, that's the milligram per deciliter, it will be about 140 to 199. Normal range of sugar, if it's A1C, we want it to be about 5. And then for the fasting glucose level, in 99 or below in milligram per deciliter. And oral glucose tolerance test, we want it about 139 or below. So then diabetes is an A1C of 6.5 or above, or fasting plasma glucose of about 126 or above milligram per deciliter, or oral glucose tolerance test of about 200 or above. It's really, really very important that you know your numbers. you can save a life, because diabetes affects so many organs in the body. You know, starting from the eyes, it can affect your eyes. That's people have the glaucoma. People have what we call diabetes retinopathy. It affects your eye, your retina, which is a part of your eyes. You know, it can lead to silent cardiac death, which is heart attacks. It can affect your kidneys. You know, it can affect your kidneys. It can also affect the nerves in your feet. And when that happens, that's why you see some people have lots of wounds. They might have a wound, they don't even know it's there until it gets discovered late. So prevention is better than cure. We heard that growing up, and it's really important. Eat right, exercise at least 150 minutes per week, and also have strength training exercises like weightlifting and all of that. And what else can you do? Sleep is also important, at least 7 to 9 hours per day, because when your body is stressed out, then so many things can happen, and it can affect various organs in your body. So stay tuned. I'll be giving you more nuggets, and we'll go from there. So let's watch what we eat, and let's eat right, be bright. It's Dr. Kangong, Body and Mind with Dr. K. Stay tuned for more. Thank you.